Hello and welcome to this live Parenting workshop. I'm Ria Thomas and I'm looking forward to hosting this workshop with Dr. Narmada Ashok, Parenting expert and pediatrician. In this live workshop with the pediatrician, you can learn about the developmental milestones in your baby. So to start with the basics, doctor, what are gross motor milestones in a baby?
Yeah, generally when we divide the milestones of a baby, right, we have something called as the motor milestones. That is to do with your muscles of the body, the way the child moves and all that. See, there are certain gross movements, like you can see it very obviously, like sitting, standing, walking, jumping. So these are called as the gross motor milestones. And there are certain milestones that are very fine, like you catch some objects with your with your tip of the finger, or trying to button your shirt, or trying to tie your shoelace. These are called as the fine motor milestones. And then you have a domain where it is a speech and language development, and then you have the cognitive development or the social skills also. So milestones is seen in various domains, and one of the domain is the gross motor milestones, where we look at the movements which are very obvious to the eyes and are very it involves several group of muscles rather than some focused group of muscles.
Thank you, Dr. Narmada. What are some of the milestones a parent can expect when the baby is 2 months old?
Right. So a parent and a 2 months old, it is just early for them to develop any significant milestones that with regard to the gross motor. But then, having said that, I would say that now the child, a newborn, is very dull, just sleeping. The movements are little smaller. They just move to very little bit. But whereas a 2 months old baby is comparatively bubbly and cheerful compared to a newborn. It starts moving its limbs more vigorously, and it tries to reach out and gross movements of the hands, but not very. It's not a. We would say, like, it's not a purposeful movements. It is they try to do something, but it is not very purposeful. It's a gross movements they have of they try to move the upper and lower limbs. So this movements should be there. It is not targeted at slowly by about 4 months. It is targeted at picking up some objects, but then during the second month, the same movements are there, but it is not very purposeful. And one more thing, this the eye contact. The child starts developing eye contact very beautifully. At least it starts focusing on the on things, and when the mother moves or the caretaker moves or the father moves, it will follow them. May not be to a full 180-degree, or no, just not turn completely and see you, but at least to an extent it will keep following you wherever you go and try to fix on your face. And most of the children will start developing some sense of a social smile. So social smile, I mean, like when they look at the mother's face and the mother wants to, and the mother is talking to the baby, then it will show the smile will start coming. So the eye contact and the social smiles are something which we would be looking at. It's not a part of a gross motor milestone, but definitely, yes, a significant milestone which we should be looking at in a 2 months old child, with gross movements of the upper and the entire body movements actually.
Thank you, Dr. Narmada, for covering these significant milestones. We have a question from Netra, and she has a baby of 3 months old, and she's from Pune. She writes, my baby is 3 months old. He still doesn't make an eye contact or smiles back at us. Is this a cause of concern?
Of
Netra.
course, Riya, this is a cause of concern, Netra. See, as I told you, in a 2 months, that eye contact should be there for a baby, and the baby should also have the social smile. So these both have not come. The eye contact has not come. I think, Netra, you should check it up with your doctor. So I want to know a few more details about your baby, because whether it was a preterm baby. Because having said term, whatever the milestones which we discussed for a 2 month old, that was for a full term baby born without any complication. Suppose you have a preterm, and that we say as an extremely preterm, very preterm. So that is about if they are born at 28 weeks of gestation, say about 7 months of pregnancy itself. They still had about 3 months. No, that 3 months development, we always give one leverage for that. So it is like they should have been born at 8 months. Like they still have 2 months, so we give that number of days. So we would wait for this baby, but then but for your baby, I need that one extra thing also. Even in that baby, they generally have the eye contact comes. So if the eye contacts and social smile has not come in your baby who has been a normal term baby without any complications, it is better that you check up with your pediatrician. Normally, you would go for your 1.5 months, 2.5 months vaccination. Now, most of the government is doing a very good vaccination drive. So most of the vaccination drive happens in your PH primary health center itself. Then you might not be going to a pediatrician to see it. But in this case, I would recommend that you see a pediatrician because the non-development of a milestone, not attaining the social smile or this eye contact, could be due to one, the neurological how the brain develops for the baby. That is one thing. The second thing is, how about the vision? Our first eye contact and the soul for us tells us about the whether the baby has any issues with the eyes. So that also has to be checked. So these things can be done only by your pediatrician. So it is better that you go to a pediatrician. And most of the time, when you go for the vaccination, the pediatricians will definitely take care of the same. But at this point of time, if you have not seen a child health doctor, I would recommend that you please go and see them immediately, just to rule out any other causes there. So if there is a preterm, if your baby has been preterm, yes, there may be an allowance which your doctor can decide whether it is normal for that age.
Thank you so much, Dr. Narmada. Now that we discussed the key milestones for a 2-month-old baby, what are some of the milestones a parent can expect when the baby is 4 or 4.5 months old?
Yeah, Riya, generally we tend to see the milestones when they come for their vaccinations, like about 1.5 months, 2.5 months. The first 45-day vaccination, then about 75 day, and then 110 days. That vaccination days, we usually take that into consideration. So 4 to 4.5 months is completely like about when they come for their 3.5 months of vaccination. So what we are looking at is, this is a time when their head control would have been gained much better than what it was with the 1 month old. So lifting a baby when in a very small, most of the fathers will say, I'm very frightened to lift because the neck is not till into the head. So every one of us who are not trained to handle a baby do have the issues with trying to hold the neck for the baby. But then if you see a 3.5 months or a 4.5 months baby, the head is something that would have gained head control. Not fully, like it's like fully means a baby can hold by itself at all angles. It can turn towards all angles and hold the neck in steady with the body. So that's called as a full head control. This we say something like a partial head control. It's not entirely wobbly, but good enough to hold it in the thing in a particular position. You make a sudden jerk, then the child will lose its balance, but then it will be able to hold on in a normal position. See, development milestone is very beautiful. God has divided like it's a craniocaudal, that it starts from the head and then goes into the legs. We start developing head control, then we have a total body control where we learn to sit, and then we get the control of the limbs, where we start to stand, and then we get the control of the whole body, where we start walking without any support. So that's the way grossly you can remember how a baby should be developing a milestone. So a 4.5 baby now starts by 4.5. 3.5 months it's partial head control. By 4.5 months it's like a complete head control. Child would have the complete head control of the thing, so that in any directions you turn the baby will be able to hold its head properly. And how do I see it? Like, you baby is sleeping on the bed or is lying down on the bed. You pull the baby now with your just your hands. The head will not lag behind. The head will come along with the body. And if you put the baby into the tummy position, right, the baby will be able to hold its head for quite a long time, compared to that what it was doing in 2.5 and 3.5 months old. But it will not lift it beyond the chest. It's just that it is fixed with the body. So this was the development you will see in a 4.5 months, which is very significant. because a baby who has not attained head control till 4.5 months, we would advise to see the doctor immediately. So this is one thing. As I said, when we put the baby on the tummy position, the baby will be able to lift his head alone. It cannot lift its chest or the upper body. It cannot control any of the upper. I mean, it cannot hold on to itself in the upper body. It's just that the full head control is got. The other thing is the baby is now more receptive to the mother's face. It has recognized, this is the mom's face, this is my dad's face. Now, at least it knows a familiar person. So when it looks at them, it starts smiling. The other thing is it can turn towards any sound. Any loud sound is there, it will definitely turn towards that sound. So this sort of the sound turning towards sound is not there, or your child does not have the startled reflex. Whenever we hear a loud that suddenly somebody closes the door forcefully, all of us get a jerk in the body. Similarly, the baby's jerk is also there. But having said that, it's a very obvious jerk because we as an adult control our movements. But whereas the kids will have a very gross jerk. So that jerk, that startled reflex, if it is not there, then it's something that we have to worry, because that is when we check the hearing also. They are interested to sounds, and they will be able to see faces and objects which is in the room, not very far, till in the room sides they will be able to see. So whenever I'm discussing milestones, I'm discussing first the gross motor milestone, then I do with the tip, and the fine motor milestones are do with the group of muscles that is very, when you group only a small set of group of muscles, and I'm looking at speech and hearing and visual milestones. Then we'll go with the social milestones. So first year in 4.5 months, I've told there should be complete head control. For the fine motor, there is nothing here except that they'll try to grab for objects, but not it. They will not be reaching out for objects, but they'll just try to grab whatever is shown in front of them, like a rattle or so. Third thing, they will turn towards the sound. Any noisy objects or toys, they will actually be interested to see, and they will have a reflex at the hearing of a loud sound. Fourth, they will be able to see the mother's face or the parent's face, as well as to a distance. When they are going in the room, the mother turns, like 180 degree. It will follow the mother 180 degree, and if she's going beyond 180 degree, he'll tilt his body to look at the mother. So that is also will be happening by about 4.5 months. He will be starting to recognize his own voice, like cooing or so. And if you tie this, we have this, in the leg we tie this, what we call golus um, in Tamil. I don't know what you call in Tamil.
I think it's
Uh,
fired. The
Yeah, payal. The payal, basically why we tie payal is children try to move the limbs. Okay, so because of the payal sound, they want to move the limbs. That's why payal actually was introduced. So they try to move the legs, they get the sound, then they try it more faster. So this gives strength to the limbs. So that they will start doing it, and they will have this cooing, which is not purposeful. They'll just make some blabbering. So it will not be responsive, but it is for themselves. So these are the key milestone you will have to look at 4.5 months.
Thank you, Dr. Narmada. We have a question from Riga Saini, and she's from Bangalore. She writes, "My baby is 5 months old and she sees cross. Will this get all right with age, or do we need to consult an expert?"
Yeah, that's a very interesting question. With very interesting observation also they have made as a parent. Looking cross, it is very momentary, but it can come till about 18 months of age. If it is a very gross cross, persistent for a very prolonged time, and if it is associated with child not having, not seeing you, as I told you, then it's something that you will have to go and look at see your pediatrician. Temporarily it comes, like you are talking to the baby, suddenly it comes and then it stays and then it goes away, and not persistent for majority of the time, then it is nothing to worry. This one will go away by about 18 months of the time. But if it is going to be persistent, continuous, and it is the deviation is much more, then it is better that you get an off-tal suggestion.
Thank you, Dr. Narmada. What are some of the milestones a parent can expect when the baby is 6 months old?
Right. This is another step. As I said, no, 1.5, 2.5, 3.5. The next step is at the 6th month. Now here the baby has gained some more gross motor milestones. So now, as I told, the development is going a bit more lower. We are starting to develop the control of our trunk muscles. So now by 4.5 months, we have got the complete head control. So now what to do is like the child has to gain control over the core muscles. So that is when, when you put the baby on the tummy position, the baby is able to lift on the upper part of the chest. You have seen all the, we all have photographs like that, putting our limbs in the front and looking at our parents for the photograph. Everybody, black and white is one thing which is very famous, and of course with now modern device, every one of us will have in that position. So this is a typical 6 months old baby who can lift his head completely, and the upper part of the chest will also come up. Now he would be able to gain a better control of the upper limbs, so that he will hold his body, and he will try to, using his body, he is lifting his chest, using his arms, he is lifting his chest. So till at the upper part, both the upper arm strength has come up, as well as head has got good control. So this is about 6 months old baby. Some babies can actually roll over, will definitely roll over. And that's also very culturally dependent. If you have been using a very soft bed and more used to picking up the baby always, they might not make an attempt, rather than compared to a baby who has been put on the floor, that who will turn over much easily. See, there are key milestones which you need to have, which every baby should have got it and should be doing it. And there are certain milestones which are like, it's okay that they did do it. We are not expecting every baby to do this. But in that way, head control is a definite milestone which every baby would have. Lifting up to the chest level or the upper third level is something every baby will do. This rolling over is something that is variable, but most of the children definitely do it by about 6 months of age. So this is the other thing. The third thing about the fine motor, the child will be, you keep the baby in the lap, it does not want to lie down on the lap. It will cry and wants to sit up on the mother's lap, and you on the caretaker's lap. So when you make the baby to sit, and if you have a cradle or some objects, it will actually go to grab it. Now the child will grab anything whichever is shown to it, and what it will do is immediately put it into the mouth. So that is when you know that the child has got a complete upper body control with the forearm, with the arm control. And now it's a very coordinated movement. I told, very purposeful, coordinated movement, looking at the objects, trying to grab it, and then putting it in the mouth. Now, then again, I want you to concentrate on the kind of grabbing it does. It's like a gross grabbing, like what the animal does, no? Just grab it like this. It's not very fine one. So it's a gross grabbing of the objects and putting it directly to the mouth. So this is a very important milestone, like a 6-month-old will definitely reach out for. Reaching out for the objects and what we call as a mouthing is a very important developmental milestone that comes in 6 months. If the child is not interested and not grabbing out for the objects, then we will definitely have a look out for the same. So this is for the gross and fine motor development. Now it starts with better interaction. When you look at the speech and all that, it makes a very good eye contact. It starts recognizing people around who are there. It starts laughing more, and it's very bubbly. I like a 6-month-old because he's perfect. He cannot move on his own. Neither he's very he'll sleep. He's more interactive with you, sitting on your lap, and it's like a cuddly toy. So he knows he will be giggling away to glory. So this is a very beautiful stage for us to enjoy as a parent. So he will be giggling and he'll be playing, trying to grab objects, put it in his mouth, look at objects that are being dropped. So here the key thing is he cannot grab the objects which is in his hand. So that will take about another 1 or 2 months. So he'll just look at the objects which are being put down, but he will not follow the objects which are dropping. So he will just look. When you're dropping it, he'll just know that they have been dropped. That's all. So this is one thing they will have. And then coming to the point of speech and interactions, he will try to imitate what you're saying. So if you want to say, yes, you want this, then the cooing becomes more purposeful with the baby. So this is a very beautiful stage which you have to enjoy.
Thank you, Dr. Narmada, for giving us those examples also. It was very informative. We have a question from Sanyukta, and she has a baby of 7 months old. She's from Delhi, and she's writing, Ishan is 7 months old, and still I feel his neck control is not completely there. Also, he has soft spots on his head, which I feel while massaging his head. Is this normal? What should be done? Please guide.
Yeah, hi. Thank you for asking that question. Nishant, now what do you mean by not gain the head control? So, if you're not able to gauge the degree of his head control, you could do it with other signs, whether putting in the tummy position, whether he's coming by 7 months. Obviously, you will support your hand, and then you will try to lift your whole of your whole of your chest from your this one. So this is something you would definitely do that. By now 7 or 8 months, your child will be able to put the weight on his limbs, upper limbs, and then try to lift completely his head and the chest. So if your child is yet not doing it, then it means that he has not gained head control. So please, and then this is like 7 months is as I told you, 4.5 months he should have had this, and by 6 months or 7 months he should have progressed to this. So if you mean to say that your child has not yet developed that, then I think it's high time you'll have to see your doctor. It's very unusual that if you have been vaccinating with a pediatrician, they would have missed this signs. And again, with regard to the soft spots you're telling, I think one is this anterior fontanelle we call. See, basically we have cranial bones, okay, that covers the skull. They are the bones that will be like a soft cartilage kind. They convert into the bones as we grow, and like in antenatal period also, the growth gets completed by 1 or 2 years of age. So then these bones have to join completely. So there is a posterior fontanelle where three bones join together, and the anterior fontanelle where we get a union of about three bones there. There's two on one side and this frontal bone going and join. So the posterior fontanelle will close at birth. When you are born itself, whatever there was a posterior thing, it will be closing, but there may be some membrane formation, and you might need and they become more harder later only. Whereas this anterior fontanelle is completely open, we call it. It's just covered by the membrane. Excuse me for that. So it gets completed and is completely closed by about 18 months of age. So this reminds us a soft spot whenever we massage the baby. And that is why whenever, even in our parts, we do tonsuring of the head more, and we wait a while, about 9 or 10 months, because the membranes will become little more thickened. So these are the soft spot. There are one more thing. There are soft spots which are present at birth. See, if the child has been born by normal delivery, right, and there is a bit of struggle at the time when your baby was born. See, I know labor pain is a most enduring pain which a mother undertakes during the entire life for her. No pain can be equivalent to it, and we all give most of the mothers undergo it so voluntarily, though there is now epidural anesthesia to bring down the pain. So we become exhausted during the second stage of the day labor. The mother is not able to push. The head gets a little bit stuck in the outer vaginal area. So what happens is there is a bit amount of, see, the why God has, when the bone of the other parts of the body are fully beautifully grown, the skull alone, the bones are not joined. It's just so soft because God has made it like that, like it's very moldable. So imagine our head coming through the mother's vagina, 3 kg baby's head coming through the vaginal outlet. It has to mold itself, no? So that's the reason it's like moldable. Once it's molded and has come out, then it starts becomes thickened and joined together. So that's the reason that our bones in the head are not joined. So what happens is, because of this molding, there may be some amount of bleeding and fluid collections that occurs. So we call it as a caput's academium. So that is where the part of the head which gets stuck in the vagina for probably for a smaller time. And there are marks that comes because of sometimes a forceps delivery. So outlet, they will put some forceps to push to aid in the delivery of the baby. So that time there can be some soft bruises because of that. The other type that can occur is if that has been a very there's been a great difficulty in pulling out the head, and a lot of maneuvering has happened from the gynecologist to deliver your baby. Then there may be something called development of a hematoma in the brain, which is called as a Keffel hematoma. So these are certain soft spots which we find during the birth. Now, Kefal hematoma is something that we are very worried because there has been a blood loss into it. So we would be very closely monitoring the baby, and the Kefal hematoma can spread in a different area in the brain, throughout the scalp region. Whereas a caput is very restricted to a particular area. It's more of a fluid collection, and we don't really worry about the same. So, but in both these cases, the Kefal hematoma and the caput, the soft spots take about 1 or 2 months also to resolve. So these will completely get resolved by about 2 months. So your child having been 7 months, the soft spot you are mentioning is mostly the fontanelles here, anterior fontanelle. But if it is present in the back, posterior fontanelle, and if it is still open, it is something unusual. This has, if the spot is still persistent, you have to consult with your doctor, because they will look at the size of the head. So if the size of the growing head is very big, then the soft spot might not have, the posterior fontanelle might not have closed. Then we would look at the brain size and all that. It does take some time for the pediatricians to assess everything. So offhand in the now I can't tell you with the limited amount of knowledge I have, but then a delay, a partial head control associated with a soft spot, you can go and see a pediatrician and get clarified whether the posterior fontanelle has been closed, whether it is an absolute head control we are talking about. But anyway, thanks for asking that very important question.
Thank you so much, Dr. Narmada, for answering it in detail and explaining us the types and reasons for this spots that Rani has asked us. So, moving on to the next question, I wanted to ask you, what are some of the milestones a parent can expect when the baby is 8 months old?
Yeah, so now we have moved on from a 6 months to an 8 months old, a slightly older child. And as I said, you there is a good amount of control over your body and core group of muscles. So which means that the child is ready to sit now. So we have finished head control. Ria, just take a minute. I just need some water. I'm sorry.
Sure, doctor, take your time.
No. So when you come to this sitting position, right? A child now, we say that sitting with support and sitting without support. So what do we mean by sitting with support? That you hold on to the baby into your lap, then you don't need to do anything. It will just keep playing and wobbling. But you keep it on the floor by itself, the child will not be able to sit by themselves. So that is sitting without support. Okay. So here, this the child sitting on your lap is sitting with support, and sitting by itself on the floor is sitting without support. So these are two things. One, and then pulling itself to sitting position is something which we have to see. By 8 months old, a child will be able to pull itself with the partial help to sit with support, to sit without support, and it will be comfortable sitting there. But one thing that wouldn't have come is what we call as a pivoting. Pivoting is like I keep an object on the straight with you, the child will go and reach out for it without any help. This is normal. But I keep a toy on the side of the baby, the trunk has to move to lift the toy. That is called as a pivoting. When it does that pivoting, the child will not be able to maintain its balance. So this takes about another 1 more month. So see, the stages, it needs a complete core control to pivot, to turn itself. So now at 8 months, the child has now moved on by sitting with support, which it has been doing from 6 to 7 months to 8 months. By 8 months, it is pulling itself to sit, as well as it will be able to sit without support for a minimal time period. But when it tries to turn for some objects, or you call from that side, it tries to turn, it will topple off. So this is that very subtle change that can come between 8 months to 9 months. So another 15 more days or 1 more month goes, the child will do anything in the sitting position. So this is what is happening at about 8 months of age. And when compared to the fine motor development, as I said, grabbing the objects has come up. Now this grabbing the objects has become more fine tuned. Now it was doing a very gross thing, and like going up and grabbing the object. Now it will be more in a very refined way. It will come directly grab for the object. The moment, which means we are recruiting more. See, when we are very disorganized, what do? We try to pull everything in the cupboard and try to do this, and so much disturbance happens. But then when we become more organized and we are getting used to a situations, then we are very fine in doing only one particular thing. Nothing gets disturbed in the surroundings. So the same way, the baby also now is recruiting all the group of muscles to do a particular action. Now it starts becoming more refined. By 8 months, it's more a focused movement, just to go and grab the objects which is being there. But still, some final movements have not come, which I'll discuss later. The third thing now it has come, what you have to look at is the social development. It has knows its keen interest and all that. It knows its parents. Now it's knows the caretakers are going to be there, and it starts understanding that there are some other person has come. It's looking like with interest of what they're doing. Still now, that stranger anxiety has not come, but it starts to know that there is somebody there. So it will be in the mother's lap, looking at them, what they're doing, what is happening there. But it's still friendly. When you talk to them, it's a little friendlier there. And again, it starts enjoying while you're dropping the objects. So this is a time when it also knows to know that it can open its hand and it can drop the objects. Yeah, and when you ask for it, no, for an 8 months old, will be ready to give it to you. A 6 months old, when you ask for the whatever it is having in his hand, for the, say, a keychain or so, it will grab it, put it in his mouth, but it will not know to release the objects. Whereas an 8 months old will beautifully release the objects, as well as it will enjoy dropping the objects. So you have seen, no, whenever they have a hand, something in hand, you throw it, they will see that, they will go and you pick it up and give. That's sort of a game for them. So they start enjoying dropping of the objects. So this is a time of more coordination, more social interaction, becoming the movements becoming more purposeful, the trunk being getting in control, but it's not yet attained complete control.
Thank you, Dr. Narmada. We have a question from Manu Singh, and she's from Udaipur. She has a baby of 8 months old, and she writes, "My daughter is 8 months old, but she still can't sit without support. Her birth weight was 2.7 kgs, and now her weight is 9 kgs. Has it got something to do with her weight? She was on formula milk. Can I make her sit with support with pillows for 1 to 2 hours in a day? Are there any exercises doing which she will learn to sit?"
Whatever you have suggested, I don't think the reason she is little on the higher side of weight is the reason she has not gained sitting without support. Maybe, as I said, it takes another 1 or 2 months, because as I said, there are gray areas. There is like a complete cutoff, like beyond 4.5 months. If a child does not gain head control, yes, it's a definite red flag sign within quote. So, but if the child from 3.5 to 4.5 months, you can't expect like, okay, turned 4 months today, my child would have attained head control. That does not there. So we give a time period where we expect the baby to have a reasonable development. So if your baby had attained appropriately head control at the right age, and if the baby has tried your tummy position and shifting her weight into the limbs and supporting and able to look at you, and if the other interactions with you are quite okay, then sitting with support is something you could wait for another 5, 10, or 15 more days. And you have very rightly said, putting her support with the pillows is something good, which you can definitely do, which you can try. And the old time mothers, our grannies used to keep the babies in the lap, and they used to keep tilting the baby up and down when they keep talking. That was a very favorite pastime of theirs. But nowadays nobody sits in a group and talks. But generally those times and all, when they were all chit chatting and all, they used to have the younger ones in their lap, and they used to keep them wobbling up and down and up and down. That movement used to give a lot of strength to the trunk muscle. They had a lot of things like that. When they used to take the baby to bath, they used to put them in their legs and bath. So at that time, what happens is, when you're pouring the water, automatically the child will lift its head and see. So they will be able to assess the baby's strength. The next they will do is have it in the lap and do this movement. So that can also be done in order to increase your strength. So whenever we assess a baby for the back strength, we also look at the curvature of the spine. What is the curvature? The spine should actually, not curve itself. When a child gets an adequate truncal control of itself, the curvature is, say, you start sitting like this, your spine is curved. When you come up, you will sit with support, but your trunk will be straight. Then in complete control, you sit without support and there has been no curvature of the spine. So the curvature also varies from the 6 months to about 9 months when we get an absolute control of our sitting posture. So you need to assess those things. If you feel that the curvature is that the trunk is very curved, and what we call as a tripod position, where you make the baby to sit, it will support with its limbs. So two limbs and the body butt is going to support the baby. So this is a tripod position. So if it is still in that at 8 months, it's okay. But if the curvature of the spine is much more and the tripod position is not yet got, then the head control has been little delayed also. I think you have to see your child doctor here.
Thank you, Dr. Narmada. Moving on, what are some of the milestones a parent can expect when the baby is 10 months old?
Mm. So we have just moved on. As I said, now we have got attained complete head spinal control, and the baby has started to sit by itself. As I said, at 9 months, it's able to pivot by itself, turning around for objects. So when it is doing that at 10 months, it's a time when the lower limbs has to be really getting ready for supporting the body. So now what it will do at 10 months, obviously, it will try to stand up. So how will you know that? When you keep the baby on your lap, it will try to climb with the support of your body. And you can see a 10-month-old actually going to your back and then putting its. This can happen only when you sit on the ground. Nowadays, none of us are making the attempt to sit on the ground, but if you do that, the child will actually hold you as a support and stand. So this happens in a 10 months old. As well as this is what we call as a cruising around with furniture. So it can hold on to any of the furnitures and just cruise around the entire area. So it will not mind what objects are in the front or back. It will keep just going around. So this also happens in a 10-month-old child. So these two are the very important milestones we expect for a baby who is a 10-month-old.
Thank you, Dr. Narmada. We have a question from Rani, and she has a baby of 11 months old. She's from Bangalore. And she writes, my daughter is 11 months old. She doesn't crawl still. Is this a sign of some issue? Should we show her to a doctor? She doesn't eat vegetables or fruits. She's just on milk and Cerelac. Could this be the reason for the same?
Yeah, very true. Very correctly, she has asked one thing. No, looking at the crawling sign, as I told you, there are soft signs and there are hard signs. Soft signs is something that if you don't even attend it, it's okay with us. It's like something which is relative. But sitting, standing, and head control are something which you should have attained at all cost. So crawling can come only if you leave the baby to itself. Suppose you have the habit of picking the baby every time, right? There are too many people, you don't leave it on the ground and it's more on the bed or on the sofas, then the child will not have the urge to crawl. So so that you don't expect. So Joe, and milestones are always seen in a group. You don't see as an isolated milestone. Okay, my head control has come, the child has started having social smile, but now it's not crawling. It's not like that. We see everything in toto. So at 11-month old, we discussed about 10 months gross motor milestone. We also to know about one more thing. In a 10 months old, what very beautifully developed is a pincer grasp. And what is a pincer grasp is it's able to pick up very fine objects, which are very smaller in size. You would see the baby, as I told you, the vision improves very beautifully from the human face. It starts concentrating on the smaller things. So by 6 months, it's able to pick up a ball or something like that. Then slowly it goes down that it can pick up very, very small rubber sized objects also. It can pick up by itself. So this happens in a 10 months old. So don't go only with crawling. You see whether your child is able to do the pincer grasp also. So these two will help you to know whether your child has attained a proper milestone.
Thank you, Dr. Narmada. Now that we've covered milestones for all the major months, next question is, what are some of the milestones a parent can expect when the baby is 12 months old?
Yeah.
So, what are some of the milestones a parent can expect when the baby is 12 months old?
Yeah, actually, in a 12 months old, you have got complete control. As I said, now you have got the hair walking, cruising around the furnitures, which means the child has got a complete control of entire body and all that. So now what happens is it is able to walk by itself. So this is the next step. It's the first sign of independence. The child wants to walk by itself, go around by itself. So leaves the hand of the mother for the first time and it moves by itself. So walking is a very important milestone that can come at about 12 months of age. Having said that, this again is not like an absolute, like it has to have come at 12 months. It could take another 1 or 2 months for the child to walk on its own. But by now, the sitting could have been completely completed. That is, the sitting, as I said, all the different stages, the final stage of the child sitting by itself and pivoting would have come one. And the other thing is the child's walking now would have definitely started with support. So here, by 12 months, it is these two would have been completely happened. But this walking independently could have started, like walked about 2 or 3 steps and then sitting by, just falling down and again trying to climb upon itself. So that can actually start. Very few children will walk more than 10 or 12 steps. That is again still 3 more months to go. So they will just sit on the floor and they will walk 2 3 steps and then sit on the floor. But definitely they'll hold, when you hold on just by a single finger, they will be able to walk for more distance. So by 1 year of age, this has become more complete. And as I said, the pincer grasp has become more refined. Now, one of the very important milestone that comes in a 1 year or sort of from 10 months onwards is your pointing towards objects. See, I'm having an interest in one object. How will I show to my mother? I'll just pull the mother initially for an 8 months old or try to attract the mother's attention or the caretaker's attention. But if it's going to be a 9, 10 months or a 1 year old child, it will pull the mother or the caretaker and point out at that object and say, Mama, 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 or Papa, something, some words, but that it will pointing towards finger should come. That is something which is very, very important for us as a pediatrician. See, when we look at the pointing, we know the child has started communicating with the parents. Now, nowadays, all of you would have heard a lot about autistic children, where it's a disease, it's a disorder of not communicating with anybody, or there is a disorder of communication. So, the first thing that comes to us, see, these children, autism children, will have everything normal. They will have a good head control, they will have a good standing, they will go for walking also normally. The gross milestones will not be disturbed at all. But what really happens is this pointing towards finger, showing interest in other objects, playing with toys will all not be there by about 1 month. It's a very soft sign, very clearly and earlier to be picked up, and so that we can follow up the child more closely. Of course, we will not diagnose at that stage, but we will have a very close follow up of that baby. So, pointing at fingers, pincer grasp, holding on to the standing with support, and able to walk for a short distance with or without support is something a 1 year old can develop definitely. And this is a time he will also able to understand what are your commands. Like, you want a cup, you give a cup, he will imitate a cup. You say go, you want something, he will start saying no, no, yes. So he will understand simple one word commands also. And one letter word will start, like one word, ma, pa, no, one letter words can start coming for him. He will have, so you have some, so he will, for water, he may call pa or pani or something, which is the native thing. So he will develop all those things, that communication thing starts developing by 1 year of age also.
Thank you, Dr. Narmada. Do environmental factors play a big role? What are some of the activities a parent can do so that they help the child meet milestones?
The environmental factor is the mother and father, the internal and external environment. So I can classify as a physical environment, and if you call it as the biological environment. And by the physical environment, I mean, see, a baby who's been brought up in a, where only two people are there, that not much of an interaction. And if the parents are more towards working from home, where they have a lot of commitments online, or they cannot they have time to be interact with their baby, these developments are far more little restricted, I would say, compared to that of a baby who is brought up in an environment where there is more interaction with that of the adult. There are grandparents who are more interactive, telling them more stories, or somebody is going to be more with the baby. Again, a baby who's brought up in a mother having a depressive symptoms, or having some social abuse, or an abusive partner, that baby can also have milestones delay. It's not actually because of the nutrition, because of the neurological. There, the condition is because of the child being ignored. The other is the nutritional status. So certain babies can have nutritional problems. There is they are expected to be at 8 or 9 kgs. They will be only 5 or 6 kgs. So those babies, because of the nutritional deficiencies, also can be like this. I forgot to tell one more important thing. She was asking whether giving the formula feeds can have an influence on the standing of the baby, sitting of the baby. Yes, vitamin D3 levels are very, very important. There are two things. One is a formula based milk. The bioavailability of the vitamin D is fortified in the formula milk. But some babies are not having adequate vitamin D because of the sun exposure or something. 98 percentage of the population is vitamin D deficient, but we go on to develop a clinical deficiency when we don't have these signs at all. So whenever a baby has attained other milestones, but when it comes to sitting and standing, if it's not gained that milestone, then we would have a check at vitamin D levels, and most of the time that has to be corrected before that. So first is the physical environment of having a nuclear family, or whether it's a joint family. Second, what is the social relationships that family is undergoing? It's a very traumatic relationships, or a normal harmonious relationship with grandparents coming in, siblings coming in and interacting with the baby makes a lot of difference. And the third thing, as I told you, is the nutritional status of the baby. So yes, environment do, and again, a child who is brought up in an environment which is highly polluted with the noise pollution do have some hearing problems too. And a baby who had antenatal issues for the mother are more cranky, more irritable. Now, having explained the milestones, I know it is very interesting to listen to it, and it's a very joyful period. But you should have enjoyed your pregnancy. You should have enjoyed your antenatal period to really enjoy. Otherwise, the baby is more of a cranky type. Cranky. There are psychological, there are sleep disturbances for the baby, and there are certain things that can happen due to environmental causes during the delivery time, which has make the labor very prolonged one, or the baby has ended with certain problems, or with the blood supply to the brain, what we call as hypoxia. So those babies are also having developmental milestone. The third, fifth thing is the genetic causes. The genetic causes, as well as certain amount of environmental infections, the Zika virus and all that comes during the antenatal period. As well as we have seen the COVID virus also. Mainly the Zika virus has produced a lot of antenatal complications, that as well as torch infections are there. We call this rubella infections and all that. That comes because of your surroundings, that can also have an impact on the development of the child. So a development of the baby is wholesome, involving all these factors.
Thank you, Dr. Narmada. We have a question from Shivangi, and she writes, my son is 12 months old. He can't stand on his own. Can we use a walker for him? If yes, how often in a day can he be made to sit in a walker? Also, please suggest some food which will help make his bones stronger.
Shivangi, Amy, thanks for asking this very important question. I wanted to talk about that walker stuff. The traditional walkers which we all used to have is a tripod kind, where it has got two wheels at the back and the front wheel. That is designed in such a way that it is able to help us with supporting us when we are walking. So this is exactly the type of walker you can get for your 1 year old. But I'm not advocating that walker, which is you can put it in the baby, and there is a tire kind of thing, and the baby can sit. So this is something like using your tubes for learning swimming. So you are very confident and you do, but then you don't have a control over your muscles at all. So this usually they start giving at 6 months to a baby. What happens is they start developing bow legs because they are putting a pressure on the thing on their legs without their. As I said, the development has to come when your nerves and muscles are ready for it from a craniocaudal direction. So when you're giving at 6 months, you're actually pushing it further. And a child of 6 months will not have any control. It will use its limbs and to move very fast. So what happens is it will go and hit against something. There may be domestic accidents that are happening. So nowadays we don't advocate the walker. I mean, we have not advocated the walker at any time. We have just advocated this tripod kind of old walker, which is just giving a support to the baby to the walk. So Shivangi, you could use that for the baby. And your baby, see, if it is standing with support, as I said, holding yourself when you're sitting on the floor or when you're holding on to furnitures and cruising around, if it's doing at 12 months old, absolutely no problem. Your baby will learn, will put on his baby steps and walk by himself in no matter 1 or 2 months.
Thank you so much, Dr. Narmada. We learned a lot of things in this live workshop today. It was very insightful. So, thank you so much for doing this workshop with us. Also, thank you, Parentune parents, for joining this live workshop.
Thank you, Ria. Thanks for that. It was also interesting for me to answer these questions.
Thank you, Doctor.